you know, when you're 6 years old, you have 6-year-olds have a lot of energy, and I basically didn't. And my mum just kind of knew something was wrong. So I went to a lot of doctors, and they were like, oh, no, she's fine. That kind of went on for about 2 years. I went to a lot of different specialists. They ran a whole bunch of tests. I don't know what kind of tests. And they were like, she's fine. There's nothing wrong with her. She's just, you know, a quiet child. They sent me away and said that there was something odd with my blood, but it was nothing to worry about. And then I think it was about 3 weeks later, I got really sick, and I got sent up to a renal specialist in Birmingham, and that's kind of where it all went downhill. They basically told my mom that I was in kidney failure and that I needed a transplant as soon as possible, and just nobody had picked that up. It got to the point where they needed to do something to stop me from dying. I had obviously 2 kidneys, and one was just completely dead, and the other was kind of getting there. So they decided to just take out the dead one and hope for the best and see if they could get the other one working again, which it did work out in the end, luckily. It was around that time, I think, that they diagnosed me with lupus.
SLE, or systemic lupus erythematosus, is an autoimmune condition. We have an immune system in our body that normally protects us from getting infections and make sure we don't get a cancer and things like that. Sometimes the immune system is unable to tell the difference between self and foreign, and it starts attacking your own self tissues and organs. And when that happens, you can develop lupus, and it's one of the most well-known examples of an autoimmune disease where your body attacks itself.
Lupus is one of those diseases that is misdiagnosed, misunderstood, because it does take a long time to diagnose, because it does mirror so many other chronic illness.
Lupus is always known as one of the great mimics. It can look like any disease. It's because it can affect any organ system, including the skin, the brain, the heart, and so on. But between 80 to 100% of people with lupus over time can develop kidney disease, depending on the studies we're looking at. And a lot of people develop kidney disease in the first 2 years of being diagnosed or having the onset of the disease. And that can often be one of the more serious consequences of lupus, because initially it's very silent. The kidney involvement is not apparent unless you look for it. And by the time you start seeing symptoms of kidney involvement, it's usually after the damage has already been done. I generally like to think of treating lupus as 2 different components. One that treats the symptoms. So if you have joint pain, you can have some anti-inflammatory medications. If you have skin involvement, you can have some topical creams and so on. And then the other is more serious, treating your immune system. And since with lupus, the immune system is overactive or activated, the medications generally try to control your immune system. And there are different kinds of medication depending on how severe you have.
When I was first diagnosed, they were trying to find a balance to get me, you know, to get the treatment done but not affect my quality of life too much. But that's really all I remember. I don't remember, it wasn't a lot of my childhood being ruined because I felt too ill, or, you know, it was kind of going about my life with these extra treatments, and every now and then I'd just stay in bed for a couple of days and, you know, then get back up and go back to school. University I found to be a bit harder. It's a lot more independent study, which is what I found difficult because I have a lot of issues with my memory, and I can't really have problems remembering facts. I found myself pushing myself harder because I wanted to, like, prove that I could do it, and I could do it by myself because I moved very far away from home. After university, I moved to Birmingham, and I ended up working at Birmingham Children's Hospital, which is the hospital that saved my life when I was a kid. And I worked in surgery, you know, organising surgeries and that kind of stuff, and really, really loved it. It was like a great job, and it paid very well, and it was just, you know, it felt good. Everything started pointing towards remission for lupus, which is always a great thing. It didn't really change that much, but it just generally felt a little bit better in myself, and my blood work was looking good. Then in December that year, I started feeling really just terrible again. I was exhausted, and I felt like I had this bug that I just like couldn't shake. I went back to the doctor, assuming, that I was flaring again and it was all coming back. And they did a lot of blood work and a lot of tests, and then it turned out, I think it's December 18th, that I got diagnosed with acute lymphoblastic leukemia. It was weird in the sense that it ended up keeping my lupus away for a very long time, because the treatments are the same treatments but just a lot more intense. They could never really give me a definitive answer of how I got it, because leukemia is one of those things, it's not really a cause normally. But there is a chance that all the treatments I was on during my childhood led up to me developing cancer. My cancer relapsed again in February 2010. I ended up getting a second bone marrow transplant from my younger sister in June that year. And after recovering from that, it's a long process, my lupus started coming back. And it came back with lupus nephritis. So my kidney started dying again. My kidney was really weakened by the years of leukemia treatment. It just kind of went from, oh hey, your lupus is back, to you're in end-stage renal failure. I was on dialysis for that for not very long, actually, considering it was a couple of months, and ended up getting a kidney transplant from my younger sister again, because she was a good match. After having my transplant, things have definitely gotten better once we've leveled out, and obviously I've got working organs, always helps. It's just been a struggle of finding the right treatment balance, because since my body's a lot worse off even without the lupus after the cancer treatment, so it's trying to find drugs that are going to work, that aren't going to be too hard on my body and I'm allowed to take. I have a lot of problems with finding the right kind of pain meds to keep my pain levels at the right time, because I'm very tolerant of them now from all the super strong drugs I had during my cancer treatment. It's hard for me to find a drug that they're willing to give me and that's actually going to work. But right now I feel like my health's definitely better. I definitely feel better. But lupus is a disease of flares and, flattening out. But it's got to the point where I just constantly feel like I'm in a flare. And then when I have a flare, it's like a super bad flare. I just find myself not being able to do hardly anything anymore, because I just don't have the energy to fight through it anymore.
Imagine waking up every day and feeling like you have the flu, and your flu is so severe that you can't get out of bed, or you simply want to pull the covers up over your head and tell the world to leave you alone. Well, that's what it feels like when you live with lupus, that the inflammation, the pain, the fatigue is so intense that you don't know from one day to the next what your day is going to be like.
I just generally feel very held back. There's a lot of things that I would like to do, but I just know that I can't do them. That might sound like a defeatist attitude, but I just know that, I recently quit my job. My productivity levels just kept going down and down, and my sick days kept going up and up, and it just got to the point where I had to leave. And when you're doing that every couple of years, you're not going to progress very far in your career. My future's not really something that I think about a lot, because with the cancer, to put it bluntly, I'm not supposed to survive past the end of this year. So it's one of those things that, I'm going to be 27 this year, and I've never really thought about what's going to happen after I reach 30, because I've just never expected to, live that long. I see all my friends and my family, off pursuing things that they want to do, and, it gets kind of depressing to know that you're just not going to do that. I get these moments where I'm like, I want to have babies, I want to get married, I want to do all that, but I know, really, I don't need that. Even if it wasn't that dangerous for me to get pregnant, I don't think I'd want to, because you'd always have that worry of, is my kid going to be sick? Because I don't want to go through everything that my mum went through with me.
Genetics tells us that identical twins of people with lupus have a higher risk of lupus, and children of somebody with lupus have a higher risk of developing lupus. Lupus can affect the quality of life as well, especially depending on the medications. Some of them that are more important are relating to having children. So some of the medications such as cyclophosphamide or Cytoxin can result in infertility in some individuals, and that can adversely affect their quality of life. And lupus itself can sometimes make it difficult for individuals to have children, depending on some of the antibodies that they can have. So that's again another way in which the disease can linger on even if it is under control. Fortunately, we are in a position where the research has come a long way towards understanding what causes lupus and also treating lupus.
The time has come, the numbers are growing. Society as a whole is aware that lupus is a chronic illness. It's not going to change. The incidence is growing, the rate of diagnosis is becoming faster, so we need to have more efforts that reach out and grassroots communities that start to talk about how do we start getting funding for lupus on a national level, or increase funding on a national level.
I think when it comes to awareness, it's something that I really believe in, and I think, you know, we desperately need, but it's not necessarily something that I want to be a part of. I feel a lot like, not to use the word normal, but I want people to see me as, you know, just me, not like the girl with lupus. I tend to, you know, keep it to myself where I can. Like, I won't tell people unless, you know, they need to know. But, you know, with the more my health deteriorates, you know, the more obvious it comes. Because there's a lot of friends that I went to uni with that never really knew, but now they do because I can't really hide it anymore.
A support system is a #1 resource that can help a person living with lupus because, you know, primarily we don't look sick. So there is a misnomer and sometimes a stereotype that's associated with a chronic disease such as lupus that says, you know, there's nothing really wrong with you. Well, you don't look it. So it's important to have people around you that understand the disease, that know how to navigate you for you or advocate for you when you're not feeling well. It is one of those diseases where you have to have a strong network. Don't be afraid to tell your story because everybody knows somebody living with lupus. They just haven't identified that person yet.
They just need to be understanding, but not, you know, step on eggshells around you. I want my support system to, you know, not get mad at me if I have to cancel plans or if, you know, I keep saying, oh, I can't do that, I can't do that. I want them to know that I can't do everything that they can, but I still want to. So include me, but understand that I can't always do it. You know, not treat me like a sick person. Not treat me like a sick person, but understand that I am a sick person.
Kitty, you're a brave girl, and I know it's only just started, but I'm gonna be there 6 with some flowers on the sticks that were clipped just to make the week strong. And Kitty, it's a strange world, girls can get so broken hearted, but if it were me and the universe, I'd get the worst of this gone.